Today I'm going to talk about modern periorbital rejuvenation. I'm going to explain how is the aging process of the periorbital area, and how is the conventional procedures for the periorbital rejuvenation, and how is my concept of periorbital rejuvenation. We can see this is an old patient, but we don't understand what are the factors, the anatomical structures that produce this aging process. You can say clearly it's an old face, but let me explain. This is a ptosis, this is a frontal ptosis, and this is also the eyebrow ptosis. This is the eyebrow, is a thick skin that must be here, and the product of the ptosis, the eyebrow, is here. Also in the lower eyelid we have an elongation of the orbicularis muscles, a loss of volume of the malar area, and a flaccidity of the lower eyelid skin. And also we can see this patient like with an old ectropion, that is product of the aging process. We can see this for the ptosis and the loss of tone of the orbicularis muscles. And also this is the tail of the eyebrow. You can see here this have a very important ptosis. But if we're going to see a young patient, if we can see here the distance between the tail of the eyebrow and the pupil is this distance. If we compare it, make a comparison between this tail and this tail, we are going to see here that the line is horizontal. All this for a ptosis process. And this is the patient that I'm going to treat today. I'm going to explain the aging process and how I'm going to focus the facial rejuvenation. In this patient also we can see here from the pupil to the tail and horizontal line. But if we are going to the lower eyelid, we can see clearly that the young patient, the junction between the lower eyelid and the cheek is almost imperceptible. We trace this line here, but must be here or a little up. But here, in an old patient, is very clear the junction between the lower eyelid and the cheek area. This product is for the elongation of the orbicularis muscle, the flaccidity of the skin of the lower eyelid, and also for the loss of volume of the cheek. This patient came to my office looking at periorbital rejuvenation. He was operated in another medical center many years ago. This patient received a conventional upper blepharoplasty, a conventional lower eyelid blepharoplasty. The conventional upper blepharoplasty consists in resection of the slice of the skin and also the muscle like this. The surgeon removed the upper eyelid and also the eyebrow skin. And in the lower eyelid, the resection is like this, cutting the orbicularis muscle and putting stitches here. The result of this conventional lower eyelid blepharoplasty is an ectropion and also the extension of the eyebrow. Here we can see another patient. Is similar to the patient that present today, and the result of the conventional blepharoplasty, the upper blepharoplasty, was an increasing of the aging process of the upper eyelid. This patient looked sad, tired, old, because the surgeon resected the upper eyelid and the eyebrow skin and descend more the eyebrow. In the lower eyelid, the result was an ectropion, and in the damage we can see in the sclera how the vast vessels that are irritated. But also the surgeon don't remove the frontal wrinkles, the periorbital wrinkles also don't improve the aging process of the nose. Okay, we have a patient with an eyebrow ptosis. We can see almost the eyebrow hair is not seen. For this reason I mark the head, the body and the tail of the eyebrow. This ptosis is product of the aging process and also is the consequence of the conventional resective upper eyelid surgery. What we must do now is a hard task. We must reposition all the forehead and also improve the wrinkles here. There are many techniques for the forehead reposition. They are acceptable today, no question about. There is the resection, this kind of marcation, the coronal, this with more shape, and resection like this, like so, and resection horizontal like this, and resection upper the eyebrow like this, and the consequent is a scar, that is a coronal scar, and the resection like this, and also the resection of the forehead lift. We must focus in a new concept, that is the reposition of all the forehead with 3 small incisions with no visible scar, and the reposition of the forehead, the frontal area and also the nose. We make a decollation of all this area, reposition of all this area, and I use carbon dioxide laser and ultrasound to tighten all this skin. Here is the patient 24 hours after the procedure. We can see here the open of the eyes. Here is preoperative, this is 24 hours, and we can see how the tail and the body of the forehead was repositioned. Here is the distance from the pupil to the tail, and here is 24 hours this distance. We can see the change of the look, the removal of the old wrinkles, and the reposition of the tail, the change of the look, the disappearance of the periorbital wrinkles. No scars, no skin resection, long-lasting results. Improve everything, the change of the look of the patient, natural result. No scars. Full forehead rejuvenation, full nose rejuvenation, full periorbital rejuvenation. And this is the result of the combination of the surgical procedure and also the laser technique. For getting this result, have many years of experience utilizing laser technology, ultrasound, and this is the global rejuvenation with natural result. This is a new paradigm, skin rejuvenation instead of skin resection. Okay, I hope you enjoyed this presentation.